Cammie, let's you and I just talk for a second, okay? First off, we have these two young ladies sitting here, and they're very impressive young women. So you must have done some really right things along the way. So you should give yourself credit for that, I can tell you for sure. You remember these times, right?
Yes.
And I look at these faces, and there's genuine joy here. There's genuine happiness here. And you contributed that a lot. And I want to tell you what I think happened here and what I think has happened here. You know, drugs have a different effect on people. Some people can take cocaine one time, have a heart attack, and die.
I know.
You know, some people are that way. Some people
are not addicted, and they can walk away.
Some people can take cocaine, can do cocaine one time and be addicted. Once. Other people can do it and walk away. You did it, and it changed you dramatically.
Changed everything about me. It checked out.
And I'm going to tell you why. This was a neurological event for you. You have what are called pleasure centers. And this involves a lot of the limbic system. And there are certain structures in your brain, the nucleus accumbens, the limbic system of the brain, that will react to a drug at times in a certain way that really alters your neuroanatomical profile in a way that things change in terms of your thresholds for pleasure and what has to happen in order for you to become at all stimulated. And you can get addicted really quick trying to get back to an experience that you've had that you've never had before. And then you can spend the rest of your life based on what's happened in this part of your brain, chasing that forever and ever. And then you start to change psychologically based on what has happened to you neurologically, and then that brings along sociological changes. And then when you do as much drug as you have done, it starts to disrupt the neurotransmitters in your brain. And so you get into what we sometimes experience as a drug-induced psychosis, which can come about intermittently at different times. But a substance-induced psychotic disorder can have delusions, hallucinations. It can persist outside of intoxication or withdrawal episodes. It's severe enough to disrupt daily functioning, and the substance involved is capable of inducing impairments. And what we're talking about here, when you say it's probably the dope, you're right. When you're having these thoughts about your phone's tapped or there's a chip in your head or something's in the ceiling or whatever, you're disrupting the neurotransmitters in your brain. It's kind of like opening up your computer and pouring water in there, and things start shorting out and connecting the wrong things, and you get really strange messages on your computer screen. There's no doubt in my mind that that's happened with you. You have really disrupted your neurological functioning.